Go get the wood.
Ah.
Hello, hello. Let me get
Hello,
your
hello.
mom on the phone. Hopefully she remembers.
Hi, Jim.
Hi, you are.
I'm Taylor. I'm the dietitian.
You're Taylor the dietitian.
Yes, sir.
Okay, let's see the goodies here. Hellman's Light Babies.
Hi there, is Susan around? Awesome, it's Audrey at Summit.
Hi, how are you?
Hey Susan, I'm great. How you doing?
Good.
We're in here with Jim. I got quite the crew, so we'll pass you around once we get going here. You want to say hi, Jim?
Hi, Mom.
Hi, how are you, Jim?
I'm good. How are you?
Good. I live here also.
Oh, good. She said Bill's there too.
Yes, hi, Bill. I'm sorry. I'm okay. How are you?
Good.
Yes.
Okay.
I'm sorry. I'm so sorry. I didn't mean to do that.
You're fine.
Okay.
I'm opening my form. All right, we got Jim, Susan, and Bill. Since we have such a full room today, I kind of want to just start with passing the phone around to everybody. What do you think?
That'll be fine.
Okay, give them their spiel. Brandon, I'm going to start with you because you probably have the best news, hopefully, right?
Hi, my name is Brandon. Physical therapy. Been working with Jim for a while. Right now, main thing that we've really just been focusing on is leg strength and core strength. Kind of help with positioning and bed mobility and being able to, move around in bed. In the past, we were working towards trying to transfer and stuff, but we kind of determined that it was unsafe because we wasn't able to do any standing up with a couple people, like 2 to 3 people. So we determined that wasn't safe. So we kind of started using a mechanical lift to get him up. And a couple weeks ago, we actually got him up in a wheelchair. But the wheelchair that he was in was just a standard wheelchair. He was not comfortable, and he did not want to continue using that wheelchair. He said he was just in a lot of pain. So right now he's wanting to get like a reclining type of wheelchair, but I'm not sure. It's kind of up to our executive director and the budget.
He's
and everything.
coming.
I don't know.
He's coming.
We'll be able to ask him what the process is, but right now he can use a standard wheelchair that's that's wide enough for him, but he's just not able to tolerate very much time in it.
It's better than laying down in a bed.
Yes, that's where we're trying to tell him that
Maybe
it's not going to
better
be
than laying
comfortable
down
the
in
first
the
time,
bed.
and it's going to take some time to get used to it.
Yeah, not even a reclining wheelchair. I was like 84 years old when I spent 4 years in a wheelchair, and it was never comfortable. I had polio when I was a child, so I know all about wheelchairs. There's if he thinks that even the bigger a single wheelchair is going to feel better, it's totally wrong. When you've been that long on a bed, nothing's going to feel right. The longer he stays in bed, the more chance for him to get pneumonia and not recover from it.
Right.
So those are my feelings. My other feelings are that you walked in there, and this is certainly not your fault. I know Jim, he walked in there, and he's now
Jim, come on, dude.
trying to bed.
Hey, can I cut you off? Actually, Jim's like throwing a fit. I'm not gonna let that keep happening right now. I don't need that, Jim.
It's the chair is too narrow. It's not that the chair is uncomfortable as a chair that it is. The chair is too narrow for me. That's where the pain is. The pain is in my hips.
At your age, they can think about what you want to know when you're at the mercy of being in a place where the possibility of you getting another chair is probably 5%
I could sit in a wheelchair that is wider than 30 inches.
Yes, but they don't have one.
I know that.
That's kind of our dilemma. All we have available are, the one that we tried it out is the widest one, so that's just kind of our dilemma. So that's where we kind of, just shifted with our focus in therapy to bed mobility, so we can be more comfortable repositioning in bed and being able to assist more with
Hello?
getting cleaned up in bed and
Great
getting dressed and
timing.
all that kind of stuff.
Yeah. Jay, we're discussing chairs, obviously.
Oh, yeah.
And it's the width of the chair that's the issue. My stepfather don't seem to understand that.
If you can't get one, it isn't an issue.
But there is one. It's a little more expensive, but there is one. I know there is one. Mom can vouch for it. She saw me at Friendship Ridge in Pennsylvania with a wider chair. Ask Mom. She knows what I'm talking about.
Listen to me. You're not going to get one, so that's
Okay, well then I'm in bed indefinitely.
well.
Or I'm moving into an apartment.
First of all, sir, how are you gonna move to an apartment if you can't get out of bed?
Well, that's where I will be.
Jimmy, don't talk like that. That's ridiculous. You're acting like a 14-year-old and I won't be one.
Yeah, right.
Oh, don't you dare talk to me like that.
Well, you don't understand. You don't understand.
Okay.
Alright. We got a whole room of people in here, so I'm not gonna let Jim keep, whatever this is. So Jay, I'm gonna hand it to you.
Yeah, so, hello, my name is Jay. I'm the executive director of Summit City, so I operate and oversee the entire facility and all the different aspects of all the departments. So we're obviously here, for a care plan with Mr. Lifton. We've been working on many different things that some of the department heads will share, and obviously one of those, as you were just talking about, was the mobility with therapy, and Brandon's here, I can go into detail a little bit more, but trying to keep him encouraged, trying to get him up, find the appropriate fitment for the chair, so he's comfortable, so he can stay out of bed. As you know, it's an ever-going process, trying to make sure that we can, do the right thing that's, comfortable for him, but in the same token that's beneficial. So it can be a challenge, obviously, given to, some of the, comorbidities that, Mr. Lifton has, and, just working on his weight and trying to get, some of these other factors that play into, his ability to do those things. So, we're working on a chair. We found a chair, that he does fit in. And so, the only concern that we have right now is trying to find the appropriate leg pedals for his safety, so he doesn't slide out of the chair, which tends to be an issue in the past. So that's pretty much.
Are you talking about the 30-inch?
No.
Okay.
Remember the one that we put you in?
That was a 30-inch.
Yeah. So there's one that's a couple inches bigger.
Wider.
Correct.
Okay.
Correct. So
That my fat hips can get into.
that will be more comfortable. Yes.
Your mother
Okay.
bearing hips.
So now, I know he's been dealing with some different pain with his arthritis and, a hemorrhoid he was telling us about that was kind of, setting him back a little bit from, being able to get up, with therapy into the chair to try the new one. But we're still pushing for that, still trying to work on that.
Okay. Okay. Well, that's good. That's
Good.
good. That's good.
Okay.
Okay.
So I'll let everybody else kind of go around. Just wanted to give you a quick snapshot.
Time for food.
Yeah, absolutely.
Thank you for everything you've done.
Yeah, absolutely. That's what we're here for, and we're going to continue to try to keep them motivated and doing the right things. And it starts with everyday choices. We've talked about that, multiple times, and we're just going to keep trying to stay on track and try to keep them in shape. Isn't that right, Mr. Lifton?
Yeah.
All right. Yep. So I'll go ahead and I'll hand it over to Taylor. She's our registered dietitian, and she can go over kind of what we're changing and trying to help with, from that aspect. Okay.
Jim.
All right.
Hello, I'm Taylor. I'm the dietitian. And Taryn, our culinary manager, is right here with me too. Hi.
Yes.
So we've been trying to work with Jim with food stuff. He's told us that a goal of his is to lose some weight, which I think is a good goal.
Yes.
So we already got him some like lower calorie condiments and stuff. We just gave them to him today. So
Yes, you told me.
yeah, so hopefully those will work out. He's already lost some weight. We got a weight at the beginning of the month, or beginning of September it was, and he lost like almost 30 pounds in 3 months.
I think I did not lose any weight from the time I was weighed last, which was some months ago. I'm at 526, which is where I was a few months ago.
Okay, well the weight that we have in our system from June was like 555.
Yeah, you gained weight and then you ended up losing some. So the weights that we have are correct.
Yeah. So,
Okay.
So
Small
that's
wins.
really good.
Yeah, that's a win, Jim.
Yeah.
So, and I know Karen's been talking with Jim a lot about, the options he has here. Did you wanna talk about that a little bit?
I came up and I talked to him. He's able to choose his own options of what he likes and, don't like. So, I wrote a list of things down that he gave me, that he can eat and that he wants. So we're gonna see if that works for him and, just go from there.
Okay.
Okay.
Yep, and then, just as a side note, he's also on Trulicity, which is a diabetes medication, but can also lead to weight loss. So that's just, another bonus.
Yes.
Okay.
Okay.
You wanna pass the phone towards Izzy and Kiefer down there?
Hello, I'm Izzy with respiratory.
I didn't see
Yes.
it.
How are you, Jim?
Alright.
I don't have much to report. There's not really any changes. It goes on the vent at night and during the days on Trig-Max.
Okay.
So there's not any changes there. Jim, you have any questions? Any concerns respiratory wise?
No, I just want to thank you so much for all you do.
Oh, thank you.
Thank you. Thank all of you for what you do.
No? Jim, nothing? Respiratory wise? No? We're good?
Yeah, we're good. I have no concerns that I can think of.
Okay.
All right. Thank you.
Next easy one will probably be
Thank
Tally.
you.
Right.
Hi, I'm Tally. I do the billing and insurance. I have a very boring part in this because his insurance is unchanged. Everything's good. Yeah. Do you have any questions about your insurance, Jim?
No, but I do have an issue as to my getting my money on the 3rd like April used to do.
So
He was always very faithful, like old Geyser, on the 3rd after 2 o'clock or between 2 and when she left, she went to everybody's room and gave everybody their money.
and unfortunately, I probably don't remember, I explained this before, that is actually against regulations. The person who balances the box is not permitted to distribute the money, just to avoid any possibility of misappropriation of funds. So since I balanced the box, that's not me. And we had an unusual circumstance this past month where there was an unusually large amount of people taking out cash prior to the 3rd. So we had to get the box refilled. The bank is also a place I'm not allowed to go. I understand April did it, and I am sorry that she confused you by disobeying state regulations. But unfortunately, it's something that I have to do.
Okay, well, the thing is that I want my money before the date that they go to the store and, put money on my card or whatever. Or get things I need, like the Splenda, things like that.
Right.
And because if the money isn't there, then it screws everything up.
Right, and just to jump in there, this is Jay again. So we do the resident trips to the store, usually that first week of the month, when a lot of those monies do come in for the different residents, and that's when they, put a list together, and then usually our activity director, or Audrey, who is now social services, or myself, we then go to the store and pick up those items or transfer the funds to their cards, which like we do for Mr. Lifton. And so, we haven't missed a day yet, in regards to the store. You always have what you need, but I do
I
understand.
know, but
I know.
I worry.
I know.
I'm a worry ward.
Well, don't worry,
No
because
kidding.
it's been handled every month, and there's been no issues. It may not be on the 3rd, it may be on the 4th or the 5th when we get the list together from all the
Okay.
residents. So don't worry, it's never gonna be missed. Okay.
We
Okay.
promise not to ever forget you.
Yeah, you're very
Yeah,
hard
that-
to forget.
Huh?
You're very hard to forget, Jim. The 3rd of every month. I
Well,
think
I
of you.
appreciate that.
Yeah.
I think now it is time for Kiefer in activities.
Hello, my name is Kiefer. I'm the activity director. I'm recently new, so I'm still learning all the residents and what they like to do, so I can create activities to get them involved. So Jim, what do you kind of like to do, or what's your interests?
Well, right now while I'm in bed, I like doing the built-in puzzles
Okay.
and not the crosswords.
Okay.
Okay. That, that's an activity that always keeps my brain going,
Okay.
which, okay. Was that yours?
Yeah.
Jay, that's yours?
Yeah,
Oh,
that's mine.
I'm sorry.
That's okay.
Okay. Yeah, other than that, I do my own activities in my room, the projects that I work on and so forth.
So you like to do more independent type activities?
Yeah.
Would you be interested in doing like one-on-ones if I sent like Leona or Bernita in here to do something with you? Would you be interested in that, or would you kind of rather just stick to your individual?
Yeah,
Okay.
yeah.
Alright.
But like I said, after seeing the price on this damn thing, I remember when it was $1.
Let me interact. What could be done with somebody else? Would it be helpful to work with somebody else to do something, Jim?
There is nothing in activities that interests me, really.
I mean, if they did
He loves
one-on-ones, that's
trivia.
whatever you'd like to do.
Yeah, they
so...
could do trivia with you, Jim. Let Joyce come in here and read you random trivia. I don't know. I know you love trivia.
Yeah, I love trivia. But,
Yeah. You can play Jeopardy with them on the iPad or something.
Yeah, it's whatever you want to do. It's
He's
not
like,
based on what the activity calendar is. It's whatever.
You don't want one-on-one time with Leona? That seems like a dream.
For who?
Jim, I want you to laugh just sometimes.
I know,
just
I'm trying.
sometimes. Okay.
I know, it's just very frustrating.
I know.
So definitely prefers to be independent with no assistance. Just kind of us give him the materials that he would like to have, and then yeah, that's kind of how he operates. So we'll just as Kiefer adjusts into the role, we'll obviously all be overseeing and kind of just making sure that he has what he needs. We all check on him on a daily basis. Somebody is in here usually, so we'll just make sure that he has what he needs to keep him entertained by himself. Okay.
Yes.
Okay. Thank you.
And I think the only person left is Miss Christie here. There you are.
Hello, I'm Christy. I'm one of the nursing managers and I do the wound care. So I guess my part is he does have the wounds on each ankle that we're trying to get healed. The left is almost all healed, but
There you are.
I'm right here, I'm hiding.
Yeah.
Got a big head, sir.
A lot of it is just his positioning with his legs and what's comfortable for him. We just do our best to try and to reduce pressure to those areas and then change the treatments as needed. So they are improving. It's just taking it day by day with those. So I don't know if you have any medication questions or concerns.
Yeah, I wanted to get the Xanax equivalent on a regular basis so that at the beginning of every month I can have a trait change. Because having a trait change is I panic.
Okay.
Okay, so the routine has been that the nurse gives me a Xanax 30 minutes, because that's how long it takes for it to take hold,
Right.
before the RTs come in and change the tray. This tray has not been changed in months, and it's now showing signs of deficiency in terms of keeping the cup deflated. And I've also been told that if the trach is in the neck too long, infection may set in. So that is a concern of mine. So I need to have the Xanax replacement, whatever it is, back on my meds list as LPN or RPN or whatever the term is, so that at the beginning of every month, the trach gets changed.
Yeah, right now it looks like you're getting your Lexapro, and that's the only thing you're getting regularly for your mental health.
But that's something different.
Okay, so we can check on getting an order for you to take the Xanax prior to the trait change.
Yeah.
Right.
Lisa, your
So-
psychiatrist, she's here next week. I'll have her visit you. You're already on our list, I bet, but
Okay.
that can get done.
And maybe it can be a PRN is what you're thinking of, an as
Yeah.
needed
As
with
needed,
the
which is
trait
once a
change.
month,
Yeah, I'll
Okay.
email her
as
and see
well
what she
as
says.
at night every night.
Oh, okay, well then we'll have her talk with you if you're having some anxiety at night.
Oh, no, it helps me relax.
Well, okay.
Because I have restless leg syndrome, which I'm taking,
Gabapentin.
no.
You want the Xanax every night, Jim?
I should be taking it every night. If it's
Okay.
not there, somebody took it off for some crazy reason.
Okay, so we'll have to see.
Did they change my medicines without telling me?
You're
No.
still on the gabapentin and things?
And they increased the gabapentin recently.
Right.
Yes,
That,
to
I know
help.
they did that.
Yes.
They
But
told
yeah,
me that, which I
I'm not seeing it.
appreciate.
Yeah, that will help.
Because I
with-
don't appreciate when they change my meds and not tell me.
Yeah. And are you still getting the trazodone and taking it at night?
That helps with sleep.
I,
'Cause it's in your chart here that you get 50
okay, well then,
milligrams.
yeah.
Okay.
Okay.
So would you rather get
I'm-
Xanax at night or the trazodone?
No, I'm supposed to, they changed the Xanax
on
to
Ativan right
Oh, you're getting Ativan.
You're on Ativan.
Ativan,
Sorry, I missed
right.
it. Yep.
So that is
okay,
the
that-
getting it
that's
at
the
bedtime.
Xanax equivalent.
Yeah.
And you're getting it at bedtime every night, 0.5.
Right,
Okay.
right.
So nothing
And
changed.
it's, right, okay, good. In addition to that, I would like the same medicine, if,
Prior.
as needed,
For your trip change.
for the trach change.
Okay.
I'm emailing
We'll work
Lisa
on
right
that
now.
then.
It's easy.
We will work on that.
All right. Well, this
Okay.
is. I gotta jump out. I gotta jump on a
Yeah.
call with
We also
corporate.
have it. I think this is a pretty good care plan.
Yeah. So,
Yeah.
but it was good meeting you. Sorry I have to jump out. But as always, Jim, if you have any questions, you know how to get a hold of us. You know what to do.
Yeah.
We'll continue to do everything that we talked about here. We'll get the med thing situated and try to get that put in for you. Okay.
Okay.
And then but I got nothing else for you. I don't know if anybody else does. I think
No.
we're all
How-
good. So
My question is, how soon can I have the chair?
So whenever you're ready to try to get up again.
I'm ready now.
All right, so I'll talk with Brandon and we'll get a date on the calendar to try it out again, okay?
Oh, okay, but it's with the new chair,
Correct.
the wider chair.
Correct.
Okay.
Yes.
Okay.
All right.
Sounds like we have a plan then, so that's good. Yes, okay.
All right.
We'll take that,
Next care plan right across the hall.
baby steps, right?
Right.
We're on our way. Thank you.
Susan and Bill, thank you so much. I know that was a long one, but yes. Yes. Yeah, we love Jim. He is, you know, he's Jim. But he knows we love him very much. Here, I'll let you say goodbye. Here, Jimmy.
Okay.
I have it on speakerphone.
Right, I know. Bye, Mom. Bye, Bill.
Bye. All right, we'll listen to everybody and keep working on what has to be done.
Okay, I will.
All right?
Yes.
All right.
Proud of you,
Thank
Jim.
you.
All right.
Love you
Bye,
too.
Susan.
Bye. Good meeting you
You
all.
too, dear. We'll call again in 3 months unless you have another concern come up. We'll do these sooner.
Okay, that's fine.
All right.
It's 3 months.
All right. Sounds good. Thank you. Bye.